And stakeholders have called for increased financing for the Nigeria's health sector in a bid to improve the service delivery of the nation's healthcare system. The managing director of Nigeria's Health Watch made the call during an event organized by the body tagged Celebrating Media Excellence for Epidemic Preparedness and Response in Abuja. Correspondent Peter Ishaya reports.
The current trend of brain drain that has eaten deep into the health sector in Nigeria, stakeholders have strongly tasked government at all levels and well-meaning Nigeria to give priority to the health sector, especially in the area of financing.
We are raising the nation's vision for the highest attainable standards, and health begins not in a clinic nor in a hospital, but in the public places, households, and cities. We continue to support the government, all the member states, to make urgent paradigm shift towards promoting health and well-being and preventing diseases by addressing root causes and building a strong, resilient health system to ensure health security.
Government has, for quite a while, not adequately funded health security. In 2020, when we had the outbreak, COVID-19 pandemic, we saw increased funding for epidemic preparedness, but that was in response to a health emergency. We want to ensure that before we are responding, we're preparing. It is much cheaper to prevent than when you are now faced with an emergency and responding to one.
Some of the stakeholders highlighted rationale for prioritizing the health sector.
This is the time to actually work harder, because if we do not do that, then the next big epidemic will come, next big pandemic, and then the cycle starts all over again.
Nigeria has been prone to concurrent health threats, and we all noticed that from the COVID-19 pandemic. But underlying all of this is to ensure that as a country, we're prepared for any outbreaks. We need to ensure that there is sustained and stable funding in order for us to adequately respond.
The group urged that the current allocation to the health sector is insufficient to cater to the myriads of health problems Nigeria is currently facing, hence need to increase it for efficient management of the sector. From Abuja, Peter Ishaya, Silverbird News 24.